Welcome back to Motors and Medicine. On today's episode, I'm going to be discussing pink eye, or conjunctivitis as we know it in clinic. So what exactly is pink eye, or conjunctivitis? Well, to put it simply, it's an inflammatory condition caused by usually some type of either infection, and that could be viral, bacterial. It could be caused by a reaction to, say, like an allergic reaction to, say, pollen, dust, a chemical in the air, something like that. And those are your two most common causes, infection or some type of allergen. There are other cases where people suffer from dry eye, or if they have a condition called lid lag, where your eyelids don't close all the way when you shut your eyes for sleep, and during the night, your eye dries out, causing some redness. Okay, these are the most typical causes of red eye or pink eye. But pink eye, it's kind of a misnomer because everybody assumes that pink eye means that you have an infection. The reality is that 90% of the time, pink eye or red eye or conjunctivitis is not bacterial. Okay, most of the time, red eye or pink eye conjunctivitis is actually caused by a virus, an allergy, or dry eye, or something else. So it's always smart to think about what the cause is and how to best treat it. If you go to a practitioner, go to a healthcare provider, and they're immediately offering you either an antibiotic ointment or drop, that is just not the most appropriate way to treat conjunctivitis. The majority of infections out there, if it is an infection, are going to be viral, and that includes in children. Children tend to get prescribed antibiotic drops or ointment far more often, and that's just not necessary. The reality is that you can very readily tell the difference between a viral infection and a bacterial infection in the eye. Most of the time, bacterial infections tend to hit one eye first, very, very profoundly, and you will notice things like heavy discharge from that one eye. And then because these eye infections tend to be very contagious, because it's an open mucous membrane, people will rub their eye and it'll kind of spread to the other side. But one eye is typically worse than the other with bacterial conjunctivitis. And it's very noticeable. It's not hard to differentiate that from other types of red eye or pink eye. Now, if a child or even an adult happens to contract a true bacterial infection in the eye, a true pink eye or a true bacterial conjunctivitis, then in a case like that, you absolutely need to use either an antibiotic drop or ointment. And actually, ointments work a little bit better because they last longer. But that is really the only case that would be requiring an antibiotic. 90+% of the time, red eye in a child or an adult is going to be caused by, first and foremost, some type of viral infection, which tends to hit both eyes about equally, allergies, which tends to hit both eyes about equally, or some type of reaction to a chemical or dust or anything like that. But again, it's going to hit both eyes typically about the same. Now, viral conjunctivitis, because it's the most common, you don't want to treat viral conjunctivitis or pink eye, viral pink eye, with an antibiotic drop, as I just mentioned. It's just not an appropriate method of treatment. A better approach to treat a viral conjunctivitis would be to use a long-lasting refresh type of drop. And the one I suggest is called Systane. Systane is Systane is how it's spelled. Systane is a drop that's been around a long time. It's essentially just propylene glycol. It's just a very benign substance, but ideally, something like Systane, it just provides a kind of a protective barrier and a lubrication to the eye. It helps eliminate the redness, and it helps to treat these things that come on when you have, say, a cold most people who get a cold end up with a little bit of pink eye. It's common to have an associated pink eye with a cold, or any other viral infection for that matter. Pink eyes are very common. Sometimes you get a pink eye from just not resting enough, not getting enough sleep. Sometimes you might get a pink eye or a red eye from maybe having a hangover or something like that. But at the end of the day, it has to do with the moisture and the hydration of the eye itself. So it's best to use something like Systane for any type of viral infection in the eye or any other type of redness in the eye that's associated with either fatigue or not having your eyes close all the way, like I mentioned, with like a lid lag condition, something like that, or a dry eye condition. Now, there are cases where you have, say, an allergic conjunctivitis or an allergic pink eye. In those situations, it's actually appropriate to use an allergy drop for the eye. That's okay, as long as you're just not using the drop too often. The only problem with allergy drops is that the effect doesn't last very long. So it's actually better to use an internal medication like an antihistamine, like say Zyrtec or Allegra, Claritin, or even Benadryl. And that internally will help mitigate some of those allergic responses with the mucous membranes, not just your eyes, but your nose as well, the runny nose that comes with allergies and such. But your eyes will get red with allergies, of course. And one good thing to do, of course, besides taking the internal, is just to use, again, something like Systane or another type of refresh drop. You can, like I said, use allergy drops themselves. They just don't have very long-lasting effects, but they do help with the redness. They are a good temporary fix. The biggest point I wanted to drive home today is just to avoid using antibiotic drops or antibiotic ointment for your average pink eye or red eye. You just don't want to be using an antibiotic on the surface of the eye over the conjunctiva when it's not appropriate, when it's not necessary. Using an antibiotic on the surface of the eye, on the conjunctiva, when you don't actually have a bacterial infection, can actually make your eye more susceptible to bacterial infections. It's just not a good idea because we have natural bacteria in our tears and enzymes that help keep our eyes clear from getting infected. If you're using an antibiotic ointment or drop when it's not necessary or when it's not appropriate, you can actually kill off the natural flora that lives in your eye, and then you'll have issues there as well. So just like I've mentioned in previous videos about not taking antibiotics inappropriately, when it comes to, or not taking antibiotics appropriately is what I should say, when it comes to true bacterial infections, whether that be strep or pneumonia or things like that. There's a lot of people that just take antibiotics for the wrong reasons, for viral infections, and you actually kill off that natural flora that lives in your gut every time you take an antibiotic. So that's why it's good to remember and question a provider when they're prescribing things that are like an antibiotic. You need to know what the purpose is for that medication, what is the reasoning behind it, and whether or not it's necessary to apply something like that to, say, your eye. Most of the time, your eyes will recover from a red eye by using just a refresh drop, a Systane, or something like that. Even just plain saline drops are fine and will help the eye clear itself most of the time. If you have really bad allergies, take an allergy medicine. You could potentially use allergy drops like I mentioned. But otherwise, most of the time, a refresh drop or something of that nature will work just fine with the majority of the viral or pink eyes that are out there that are not bacterial. And like I mentioned, if you do happen to contract a true bacterial infection in the eye where you know you're having really strong, heavy, purulent discharge in one eye, potentially both eyes, you know that that's going to be more likely bacterial. And in cases like that, yes, a bacterial ointment or drop for the eye is very appropriate and will help get rid of that infection. So keep in mind, hydration of the eye is usually the most important way or method to eliminate redness in the eye. So, and for example, I happen to have a little bit of lid lag, meaning that when I close my eyes to go to sleep at night, my eyes don't close all the way. So there's a small portion of my eyeball that is exposed to the oxygen and to the air all night long. So when I wake up, I typically wake up with a little strip of red eye across my eye. So I use these same drops, clears up, and then I'm fine the rest of the day. And like I mentioned, there are a number of other conditions like dust and allergies, viruses that can cause the red eye to come on, fatigue. But the key points here are, number one, use a simple refresh drop for most red eyes, including viruses. Use the antibiotic ointment or drops for true bacterial infections of the eye. And then there's one other drop I was going to mention, and that is using a steroid drop. Now, are steroid drops appropriate for red eye? Yes and no. There are some conjunctival conditions or red eye conditions, inflammatory conditions, whether it be from a chemical, an allergy, a virus, that just are not responding to a good refresh drop after a few days of use. And then in that case, a steroid drop might be considered. The only caveat to using a steroid drop is that if you use it for too long a period, and by that I mean more than 2 to 3 days, 2 drops twice a day, 1 to 2 drops twice a day for 2 to 3 days, max. Any more than that, and then you start to run the risk of thinning out the cornea because of the steroid effect, and you can also have a side effect in the long run of developing cataracts from using a steroid drop. So keep that in mind. If you are prescribed a steroid drop for a red eye, which is not uncommon, just keep in mind that you don't want to be using the steroid drop for very long. Most of the time, like I mentioned, you can get rid of your red eye with just using refresh drops or Systane, something like that. And if you did have a true bacterial infection, of course, the ointment or antibiotic drops. But kind of in the middle ground, that steroid drop, it's appropriate in some cases, but you just want to use it sparingly and not for more than 3 days to avoid those complications on the surface of the eye. So hopefully this information was helpful for you to understand true red eye, pink eye conjunctivitis. And hopefully you understand how to best treat it now, how to approach it, how to question what kind of medications you've been given for your eye. And if you like this video, please give it a thumbs up. And like always, I appreciate all your support. If you haven't subscribed to the channel, please do so. It'll help it grow. On the next video, I'm going to be getting back into the motors side. And I'm going to be installing another part on the Bronco, so we should have some fun with that. But until then, this is Motors and Medicine signing off. Thank you very much. Have a good day.